Emergency management is there to be the coordination body, to bring in all the necessary agencies for planning, for training, or for response. The individual agencies, whether it's the police service or fire EMS or public health, is to bring in the subject matter expertise specific to their discipline. So on an emergency management led event, they'll be asking questions of all the other agencies. What do we need to do? What are you bringing? How are we going to solve for? And then they coordinate that entire activity while personnel are forward operations, personnel are assigned to logistics or finance. Some emergency managers still remember when they were in operations and they want to run scene management, and that's really not the mission of emergency management agency. They are the coordination body. Public health's mission is to support field operations, but also to be part of intelligence gathering, surveillance and trend data forecasting, ensuring community involvement, ensuring that all resources within the healthcare enterprise can be made available for an activity. So what public health brings to an emergency response that emergency management would need is a larger understanding of the health of the community, the dynamic of the population that you're working with. In some jurisdictions, they have direct line of control over the entirety of the healthcare system. So the hospitals, the subacute care facilities, the doc and the box, the NGOs that are providing public health care, providing health care. Emergency management shouldn't expect to know all those things. If we use an example, building evacuation, what would public health's role be in a building evacuation? Support, and even minimal support at best, because public health would not be standing up into a command position. We would be there in a liaison role if there were health impacts or injuries or like that. Now let's take this evacuation and it's a hospital. Public health would be in the command as either the incident commander or joint task force commander, because a hospital, when it's being decompressed, patients can't just go anywhere. So you have to understand the acuity of the patients, you have to understand the type of care they're going to need, you're going to have to understand the facility that you're transporting them to. Do they have those resources to sustain that care? So ensuring the alignment of resources and personnel and bed availability is where public health would shine in that type of situation. So when we're looking at collaboration between emergency management and public health, Callan JMB is well positioned with a cadre of professional subject matter experts in various fields to help support some of the decision trees that would need to be made and give an outside perspective of what could be interpreted as part of this action. Callan JMB serves as the tool. We're a tool to be utilized by that jurisdiction or that client to whatever level they feel necessary. We're well positioned to provide suggestions, examples, opportunities to create efficiencies in a response, in a plan action, or in an activity. At the end of the day, every agency's goal is to protect human life and to be as efficient and as effective as possible in solving a problem and getting the community or the facility or the individual back to their normal baseline.